So this study is really significant for multiple reasons. First of all, it's significant for the thousands of patients who suffer from kidney disease, who are awaiting transplant, and who suffer the loss of loved ones who often die while waiting for kidney transplants. Although the study doesn't automatically make that possible, it really begins to open the door of a potential unlimited supply for kidneys that can affect the lives of Americans and citizens across the world if we're successful with this transplant model. This has been possible because of the advent of molecular biology. In similar ways, how we've made such progress in vaccine development, our ability to manage the genome through the technique and tool of CRISPR-Cas, which allows us to slice and place genes in particular areas, remove genes and edit them. So really an editing process really has transformed what we could conceive of doing with xenotransplantation. So whereas in the past, we largely tried to manipulate our immune system to accept a foreign organ, whereas now we've made that organ more human by affecting the genes that it is made with and the genes that make up that animal that allow those organs to be accepted. The support of United Therapeutics was very fundamental to developing a program and a process that led to an animal that was genetically designed for this process of transplantation. One of the main differences is the dedicated facility that we've worked with United Therapeutics to design for a biohazard-free process of harvesting the organs from these genetically modified animals. And in that process, we are able to reduce the risk that we think of infection transfer, bacterial contamination, viral contamination, to give our patients the best opportunity for a successful transplant. The other piece is that this kidney and these animals were distinctly genetically designed to maximize their opportunity for a successful organ transplant. I really admired that from the beginning, our leaders, our surgeon scientists and physician scientists took the approach, we want to do this in a manner that it be reproducible, that if others were to do it, we give them a roadmap to how it's done. Number two, we wanted to create a roadmap for ourselves, that when we were to do it again, that we had a standard of separating separate operative procedures, separate operating procedures that would allow us to do this effectively on a regular basis for our patients. By doing that, we thought and believed and do have a study that others would appreciate, value how we designed and set it up, value how we identified our endpoints, and value how we actually conducted the procedure and the study. And the outcome speaks for themselves. But how you get to those outcomes are the things that other scientists and physicians want to know, because they really create the predictability that somebody else can do it, right? So peer review and the tremendously important part of science is reproducibility. Think about science that only can be done at one place, right? Doesn't bring any value to mankind. Good science and the Nobel Prize, when it's given because someone's done something that has allowed the rest of the world to use it and be transformed by it. So we took that approach. We wanted to be one of the first to do this, but we wanted to do it in a manner that others could follow and we could actually repeat.